Hi, this is Dr. Sopan Nagpal. Today we'll talk about rabies. Recently in the news there was a story about a young girl who developed rabies after getting bitten by a stray dog in Delhi. Unfortunately, she lost her life. We have to realize that rabies is a fatal disease if it affects human beings. The only way to protect yourself from rabies is to prevent it from happening to you. How does rabies spread? So rabies is a disease which happens through the transmission of a virus, rabies virus, that infects human beings through bites of infected animals like dogs, cats, and some other animals. Now, this virus is in the saliva of these infected animals, and if this saliva is exposed to our mucous membranes or broken skin, it can infect us. What do you do to prevent rabies from happening to you? Now, the first thing is to vaccinate the dogs and other animals in your house and around your house. If these animals are properly vaccinated, there is very low chance of transmission of rabies amongst these animals and in turn from these animals to you. But what if you have a bite by a dog? What do you do then? So for example, if your pet dog bites you and there is a wound, the first thing to do is to clean the wound with soap and water, wash it thoroughly and disinfect it with something like Dettol and betadine, and then rush to the hospital. Once you reach the hospital, the doctor will advise you what to do next. There are three categories of such exposures. Category 1 is licks on unbroken skin. So if your pet dog is licking your skin and it's unbroken, there is no chance of rabies happening even if the dog has it. Firstly, your dog should be vaccinated. The second category of exposure is scratches that happen on unbroken skin. And remember, these scratches should not cause bleeding or nibbling of the skin without causing bleeding. This is called category 2. And category 2, after cleaning and washing of the wound, demands vaccination. So 5 doses of rabies vaccine should be given in such patients according to the schedule. The last and the most important category, and the category that we see very often, is category 3. In this category, there is a transdermal wound. So if your dog bites you and there is bleeding, that means the skin has been pierced, the blood has been exposed, and that is category 3. Now in category 3, the management is a little different. In category 3, obviously you wash and clean the wound and disinfect it, but along with the full vaccination schedule of 5 doses of Rabivax, you also give immunoglobulin against rabies virus or monoclonal antibodies against rabies virus. Now these monoclonal antibodies or immunoglobulins are infiltrated into the wound where the bite has happened. This is because by chance, if there is a virus that has gone, rabies virus that has gone into the wound, you kill it there and then with the immunoglobulin or monoclonal antibodies. So remember, there are 3 categories. Category 1 does not require any vaccination. Category 2 requires only vaccination, and category 3 requires vaccination as well as immunoglobulin infiltration into the wound. Now, if someone has been fully vaccinated and few years later has another dog bite, he or she will need only 2 booster doses. All these things are important. Remember them, because as I said earlier, rabies can only be prevented. It cannot be cured if it happens to you. Thank you and take care.